Thank you, Dr. Hyman. You're now recognized.
Thank you, Mr. Chairman and members of the committee for the opportunity to testify before you today. My name is Dr. Mark Hyman. I'm the chairman of the Food Fix campaign. I'm the co-founder and chief medical officer of Function Health, the fastest growing consumer health platform in America, empowering people to live 100 healthy years through data-driven healthcare. As both a doctor and a concerned citizen, I'm very grateful for your focus on food and the chronic disease epidemic facing our nation. I especially wish to thank you, Vice Chair Buchanan, for your leadership in establishing the Bipartisan Preventive Health and Wellness Caucus with Congressman Moore. It's a critical step in addressing the human and economic burden of chronic disease. And like you, I'm deeply committed to reversing America's chronic disease epidemic by addressing its root cause, our modern ultra-processed diet. Unlike healthy foods, ultra-processed foods are high in sugar, starch, refined oils. They often contain industrial ingredients such as preservatives, emulsifiers, artificial flavors, colors, and sweeteners. Also, they have a long shelf life and are fast to prepare and eat, but with devastating consequences. Nutritious food has the power to make us healthier, but processed foods drive the chronic diseases that are the leading cause of death and disability in the U.S. today. 60% of Americans have at least one chronic disease, 40% have two or more. 93.2% of Americans are metabolically unhealthy. What does that mean? It means they have high blood pressure, high blood sugar, abnormal cholesterol, are overweight, or have had a heart attack or stroke. That means 6.8% of Americans are not metabolically unhealthy. And 1 in 10 Americans has prediabetes or type 2 diabetes, including 1 in 4 teenagers. And the culprit is what we consume. About 60% of our diet is ultra-processed foods, which are new to nature foods. They're not really food by the definition of food. And among children, the share of their diet that's ultra-processed food is 67%. For every 10% of your diet that's ultra-processed food, your risk of death goes up by 14%. It's the #1 killer globally. Ultra-processed foods also impose a huge burden on our healthcare system. Since 2000, national healthcare spending has ballooned from $1.3 trillion to $4.9 trillion. But although we're spending more and more, we're getting sicker and sicker. We rank 30th in the world in key healthcare metrics, like infant mortality, and last among developed nations. We are 48th in life expectancy. I think Cuba's higher than us. We accounted for 16% of the global cases of COVID deaths, even though we're only 4% of the world's population. Why? Because COVID kills the chronically ill and obese. Fortunately, there's a solution. It's harnessing the power of eating more nutritious foods. The fact is that most diet-related chronic diseases are preventable and, as Senator Frist said, even reversible if we change our diet. And that is the Food Fix campaign's singular goal. Now, fortunately, there's mounting research that proves that food is both the cause and the cure for most of our chronic disease epidemic. Yet doctors do not learn about nutrition, nor does our healthcare system reimburse for treating patients with the most scientifically effective tool to reverse chronic disease, food. Take Janet. Hopefully we can show her picture here. This is Janet, who was a minister from Ohio, came to our center at Cleveland Clinic. She had obviously severe obesity, type 2 diabetes, on insulin, heart failure, hypertension, fatty liver, failing kidneys, on her way to a heart and liver transplant. Her annual copay for medication was $20,000. After 3 months, she reversed all of her diseases and was off insulin and all her medications. This is something we learned is not possible in medical school because we don't learn about how to use food as medicine. And this is Janet a year later. She lost 116 pounds and got her life back. The data clearly demonstrate that we can not only prevent type 2 diabetes, but we can reverse it. And data show with a ketogenic diet that 60% of people can have their diabetes completely reversed, 100% reduced or eliminate their medication at a savings of $6,000 per patient after the cost of the program. If scaled across Medicare, this would save over $90 billion a year. Now, here are ways you can address the problem. First, I want to applaud Chairman Buchanan and the committee for including in the American Medical Innovation Investment Act a medically tailored meals demonstration in Medicare. Now, under this incredible demonstration program, qualified beneficiaries would receive medically tailored, home-delivered meals, and medical and nutrition therapy. In the future, the standard of care can be further incentivized with a Medicare add-on payment for nutrition-focused treatment. Second, we must train tomorrow's clinicians in the science of nutrition and its role in causing and curing chronic disease. In medical school, I learned nothing about nutrition. 40 years later, my daughter, a fourth-year medical student, also received zero nutrition education. We can change that by setting minimal competency requirements in nutrition in all federally funded medical schools and graduate medical education. And finally, I encourage the committee to consider a novel but proven direction. And I believe this could change so much about what's wrong with our country. We all know that changes in diet and physical activity can reduce the risk of developing type 2 diabetes by 58%. But new research clearly demonstrates that type 2 diabetes is not only preventable but reversible. And that's why I encourage you to establish a national diabetes reversal program to address the single biggest driver of disease and costs in our healthcare system. In closing, I want to thank you all for all you're doing to solve America's chronic disease epidemic. This is a national emergency, and it demands a national, bold response. We know that food is medicine, and together we can build a healthier and more productive and safer future. Thank you.